On the Record with WRAL News.
The next phase of the pandemic will no longer be a waiting game for the COVID-19 vaccine. The supply will be there, but will the demand? Good evening, and thanks for joining us for On the Record. I'm Lena Tillett. The state's top doctor, Mandy Cohen, says if roughly 70% of the state is vaccinated, we should reach herd immunity and get back to normalcy, not having to wear masks, easing social distancing, freely traveling, and widespread protection from the virus. But this time, the road ahead will take more than science. It will take convincing millions of Americans, including North Carolinians, to get the vaccine. According to High Point University's latest poll on vaccine interest in our state, take a look here. 41% of North Carolina residents said they intended to get the vaccine when the shot is available to them. 13% said they had already been vaccinated. 34% said they did not intend to get the vaccine, and 11% did not know. That's 45% of the state either unsure or not getting the vaccine. So what do we do about that group? In a recent story about vaccine hesitancy in The Atlantic, Derek Thompson writes, quote, I called several doctors and researchers to ask how we could reverse vaccine hesitancy among the groups in which it was highest. They all told me that my initial question was too simplistic. Vaccine hesitancy isn't one thing, they said. It's a constellation of motivations, insecurities, reasonable fears, and less reasonable conspiracy theories. The experts instead gave Thompson 4 categories that I think really more or less sum up the reluctance here: vaccine dissent, deliberation, indifference, and distrust. And I thought that was a good framework for our discussion tonight. And we are joined by one of the doctors who contributed to that report, Dr. Giselle Corby-Smith, who is a professor and the director of the UNC Center for Health Equity Research. Dr. Robin Peace is a physician and president of medical staff at UNC Health Southeastern. And Dr. Deepak Kumar is director of the Chamber's Biomedical and Biotechnology Research Institute at North Carolina Central University. Thank you all for being with me tonight. So I'll begin with you, Dr. Corby-Smith. You coined the term vaccine deliberation for this article. I think it was the most optimistic of all the terms. Specifically talking about reluctance among Black and brown people, you said, quote, we talk about Tuskegee, but it's not just the history of exploitation by the medical field. It's their current day experience with the healthcare system. What did you mean by that?
Lena, thank you so much for that question. It's really a pleasure to be here. When I talk about vaccine deliberation, we're talking about that slow yes. The decision that's being made cautiously by many Black and brown patients as they experience the healthcare system, a system that has yet to demonstrate that they value their lives as highly as the lives of other populations. They're looking to see what happens to their family members. They're looking to see the side effects from their loved ones. They're looking at the statistics about general side effects. They're looking to see, how much do you care? Are you really making sure that we actually have access in our communities? These are all the things that people are deliberating, looking at carefully to make their own decision. In this instance, I think the old adage, when I know that you care, I'll care what you know. It works. It's because people want to see that you care. They want to know that they're participating in a system that actually cares about their lives.
And when you talk about the difference, though, between that historic atrocity, the Tuskegee experiment, which there's been a lot of disinformation about, but ultimately what happened in that experiment is that they did not care for those men who did have syphilis, versus current day, what are the disproportionate health outcomes that people are dealing with today?
We're seeing over and over again, for as long as we've collected data on race, ethnicity, gender, social class, that there are some that are advantaged in the system and others that are not. Some that enjoy good health and have the opportunity, all the opportunities to live a healthy life, and others, typically Black and brown, poor, rural communities that experience poor health outcomes over and over again, whether it's from childbirth to cardiovascular disease, chronic diseases, to acute infections like COVID-19 and viral illnesses. We see over and over again the disproportionate impact and burden that communities of color, poor communities, and rural communities experience in our health system.
There is some positive movement in terms of people's attitude toward wanting to get the vaccine. Dr. Kumar, a survey that your group did before the vaccine was approved by the FDA showed widespread reluctance among Blacks and Latinos in North Carolina. But in the months since, at least national polls show a big jump in interest. Why do you think that is, and do you think it will be enough?
And thank you, Lena. Yes, I think we have seen the same kind of trend which nationally people have seen, that when we started collecting data back in August, our hesitancy was as high as about 78% of individuals were hesitant, especially people of color were hesitant to take the vaccine. But we also have to see what was happening at that time in the country. I mean, there was so much uncertainty about the disease, about the state of the nation. And so we did see a decline in September, October, but not as much in African Americans. We did see a decline in other communities like whites. We did see a decline, Latino also, but not as much in African Americans. November comes, election comes, there was a bit of hope. We started seeing a bit of more decline in hesitancy. And in November, when we started getting news about the vaccine, that we have 2 vaccines which are showing promise, we started seeing significant decline. But even then, African-American decline was about 60%. December 18 comes and FDA approves 2 vaccines. I mean, that was really a good news. So what we did was in December 19th, we launched a new survey that, just to check, because, it is such a moving target. And the drivers of hesitancy are evolving with time. So we wanted to capture that. So we did the survey, and from December and January, what we have seen is we have seen significant decline, as much as that hesitancy in African-American is about 37%. And our survey is different because we are doing the survey using paper and pencil. And reason is because we wanted to address the digital divide. I mean, you want to look at the hesitancy in underserved population who don't always have the means to do these surveys using these internet and mass, digital methods. That's why we want to do this. So we have seen significant decline in the months of December and January after the vaccine, is released, and a lot of people have taken in among African American.
And that's certainly
what we have seen, if I may, is that decline is different with locations. And that's something that we are looking into it right now.
Welcome back to On the Record. Tonight, we're talking about the complexity of vaccine hesitancy and how to tackle really tough conversations. Dr. Peace, I played that sound from Dr. Cohen just before the break, where essentially she said all resources will be used to make sure that there's equitable distribution of the vaccine. You're in the trenches. Are you seeing these efforts that the state is talking about, and where could they be better?
Yes, I'm in Lumberton, and we have been very pleased with the number of vaccines that have been allocated to Robeson County, where I am. We actually have people that are coming to our county from other parts of the state and even other states to get their vaccine. And so, we're very pleased with the number of vaccines that are coming. I think that, I really don't know about the other areas of the state. I wonder if they're getting the same amount, because we have people coming from Charlotte and the Triangle area, even South Carolina, to Lumberton and Robeson County to receive their COVID-19.
Before I get
Lena,
to...
if I could...
Oh, sure.
Sorry, I just wanted to jump in because I think Dr. Peace makes a really important point, and coupled with Dr. Kumar's comments, I think I just want to put a finer point on something that, as of August, we knew that there was hesitancy, quote unquote hesitancy. You've already pointed out, prefer the term deliberation because it doesn't blame the victim for not moving forward in a decision. And as these slow yeses require showing and demonstrating a system that's trustworthy, that's worthy of an individual placing their trust in them. So since August, we knew that we had an issue that we needed to address. And Dr. Peace is describing what some people have called vaccine tourism, moving into Black and Brown communities from other areas, other geographies, to take advantage of the fact that of this slow yes, of this deliberation. And a lot of it goes back again to what Dr. Kumar talked about, which is this digital divide. We have a system that has been equal. Everyone theoretically has equal access. If you live in a place that has broadband access, if you have a computer or some other way to get into that access, if you have a job that allows you to take time off to troll the internet and to find those vaccines, if you have the transportation to drive from Charlotte to Lumberton to get those vaccines. So when we're talking
How then might you
about
address
equal,
that then?
right,
Would you turn people away? I mean, especially people who are in North Carolina, can you turn them away and say, well, look, this was meant for an equitable distribution, or do you have to just give people the protection that they also are entitled to based on what the government has provided?
Yeah, we can't turn them away. So, and one of the points that I make to patients as I'm talking to them, that ones that are still on the fence, is look, why do you think people are traveling from other parts of our state to come and get their shot? While you're waiting and deliberating, there are other people coming to our county. We are getting all of these vaccines because we are, in fact, the sickest county in the state of North Carolina. So we're getting all these vaccines because we have a county full of people with high-risk conditions that are at risk for serious illness and death from COVID. So I actually use that to coach people off the fence.
Interesting.
I think, and kudos to you, Dr. Peace. I think you make such a good point to really use this to convince people that it's such a good vaccine. People are coming from everywhere to get the vaccine, and you are denying being here. So I think that's such a good way of seeing things. The other piece also, what I have noticed is people are feeling comfortable, because there was a sense that, are we getting the same vaccine in this neighborhood versus the other neighborhood? So when people see from every class and every color coming to the location, then they feel a bit more comfortable that yes, we are also getting the same vaccine. So I think, and we have to use every opportunity.
I would say one missed opportunity, I actually no longer missed, but maybe missed early on, was the really important network of community-based, faith-based organization, trusted institutions in each of our communities, each of our Black, brown, rural, urban communities that could also play a pivotal role in ensuring that people have a trusted source to go to, in addition to their healthcare professional, to be able to ask the questions that they may not feel comfortable asking me or Robin, but they might feel comfortable asking sort of a community health worker or an elder in the community. Empowering those individuals, organizations, and people to be able to have the information, to have access, and to be able to distribute the vaccine. This is where we're seeing that shift and that pivot in terms of uptake as well across our state.
Welcome back to this discussion about vaccine reluctance. I want to get back to Dr. Peace, particularly because you're a family physician and you serve parts of Robeson County, and I know you see every demographic, including a lot of rural residents. I want to know what you hear most from your patients about why they won't get the vaccine.
The number one thing that I hear is people say they're afraid because the vaccine came out too fast. They're concerned that not enough research was done, that it was rushed to emergency use. They are worried about long-term problems that they may have. I recently have been hearing about young women are concerned that it's going to make them infertile. And people that are the sickest that would need to take the vaccine even more than others, they're worried because they think they're too sick to take the vaccine. They're worried about the medical problems that they have and that they may be too sick. And then, severe allergies. There are patients that, have had anaphylactic reactions to different medications, maybe bad experiences with influenza vaccine. So then they're saying, well, I'm worried that I'm going to have a severe reaction.
And what do you say back to them? I mean, do you respond to each concern with a very specific response?
Well, I would have to say no, because every person is different. But the first thing I start off is that I believe that the vaccine is safe, it's effective. And I was the 5th person in Robeson County to take the vaccine. I took it early because I wanted to be an example to the patients that I serve. I wanted them to know that I took it. If I didn't think it was safe, I wouldn't take it. And, she's right. People don't care what you know unless they know that you care. And what I tell every patient is that some others may have a certain agenda. My agenda is 100%. I care. I care about the outcomes of the patients in my community. And so that is why I continue to use every opportunity that I have to let people know that I believe the vaccine is safe, it's effective, and you need to take your shot.
Dr. Kumar, research shows that healthcare providers are the most trusted entity in the country at this point. It's not going to be journalists that are able to convince people to get the vaccine. Are you all testing certain messages to see what works? And if so, what are they? Help us out.
Well, we are, and we are testing different kind of messages. We have also seen the same thing that every community is saying. They want to trust healthcare providers and community health workers even more so than the faith-based leaders. That's what we are seeing everywhere. And what we're doing is we are doing different kind of testing. So for example, in our RADx Up, RADx UP project, which we have in the Robeson County, in the Lumbee community, we are focusing more in the family value, the kinship, because multi-generational families, a message based on that is a bit more effective than other messages. We also heard from our community, and we are doing small focus groups to identify what kind of messages. People are a little tired of these sober messages. People have lost their loved ones, their families, family members. They want some positivity. So we are trying to portray some messages. We are also trying to do messages where we have providers from the community on the images. So they see somebody they can recognize that, look, they have taken the vaccine. The tribal leaders in the Robeson County, they took the shot and they were on the page and they're showing their vaccination shots. I think those kind of messages help to tell people that it's a safe vaccine, it's an effective vaccine, and this is the only way to get back to where we want to be.
The other thing that I tell people is that you're not just taking it for you. You're taking it for your loved one that could get sick and die from COVID. You're taking it for your coworkers. You're taking it for your friends, for the people in your church. A lot of decisions that we make, it only affects us as an individual. But as it relates to this vaccine, it affects the whole community. So I've been trying to appeal to people's sense of community and their heart for their fellow man.
And honestly, as a primary care doc myself, I am honest with my patients about my initial deliberation, and I share with them the data that I looked at also to make that decision. I share with them the conversations I had with my parents, my 91 and 84-year-old parents, about them getting the vaccine and the fact that they have gone forward and gotten it. So, and my sister has gotten the vaccine. So these are, I mean, I think there's no way to be other than authentic and honest about sort of the ways that each of us has approached this. It's complicated. It's not as simple as it could have been or should have been, but it is what it is. And this is where we are right now.